Hello, everyone. This is Suzanne Marcellus, CEO and founder of House of Protection. And I am so honored to have Dr. Gettings with us today. She is a double board certified psychiatrist, and she does psychiatry in one of the best ways that I have learned of. And it's something that I am passionate about sharing with all of you. So she has committed to doing a few talks with us over the next few months on brain health, and you will have an opportunity to ask some questions towards the end. So I just want to ask Dr. Gettings, Dr. Gettings, thank you for being here. Please tell us a little bit about yourself.
Sure. Thank you so much for having me, and great to see everyone. And thanks for that great introduction. I am originally from Chicago, grew up on the South Side, and completed my doctorate of medicine at the University of Chicago back in 2007. I specialize in functional psychiatry and have also completed training to work with children and adolescents. So essentially, I'm a child, adolescent, and adult functional psychiatrist. And I add the functional piece because that approach to brain health and wellness isn't necessarily the traditional approach that we've seen for a very long time now. And I work with a lot of doctors that are in a space where we're really committed to raising health literacy and ensuring that when treating anyone presenting with brain health concerns, that the approach to evaluating them is individualized and functional. So getting away from a cookie cutter, one size fits all labeling approach that doesn't allow people to make informed decisions, understand even what their treatment plan is. Very much so about collaboration. And I've worked in a lot of different settings, ranging from inpatient psychiatric units to the prison system, foster care system. The last 10 years, I've done a lot of different or worked in a lot of different spaces providing clinical care with my own outpatient practice, Clarion Conscience, and also spending time once I moved to Florida from Chicago back in 2019, working at the largest federally qualified healthcare center in Broward County and providing psychiatric care on an outpatient basis in Lauderhill and Pompano Beach, Hollywood, and Hallandale. So I've been here in Florida again since 2019. Chicago just became a little too cold for me, but I'm still Chi-Town. So yes,
We
Cheyenne. That's what I call it. Cheyenne.
Miami.
Yes.
Okay. Well, we're so glad you're here on the sunny side,
Thank you.
here over here. You know,
Thank
you
you.
can you tell us a little bit about why your practice is called Clarion Conscience? And then if you could also share, how does your approach, when you say it is a more individualized approach versus a cookie cutter approach to psychiatry, can you kind of let us know like what the difference is, what that
Hmm.
looks like, please?
Sure. So, um, Clarion Conscience means clear conscience because my approach to helping people on their wellness journey is to do everything with a clear conscience. When I first started to be trained as a medical doctor here in the US, there's a lot of things that I see that are done in ways that I think people inherently know is wrong. And because a lot of systems are broken, we're oftentimes we feel compelled to work within those systems, even though it requires us to do things that ethically, morally, is not in alignment. So I have a real low tolerance, or I guess you could say no tolerance for that. And so when I started my own practice, I really wanted to make that the focus. One, establishing trust and knowing that you're working with a provider that's going to do everything they do to help, everything they can, excuse me, to help you make informed decisions. There's no deception. I'm not trying to, I feel like with psychiatry, there's so much stigma and lack of trust within the medical system. So it's really to communicate that that's a principle that I live by and work by and serve others by. As far as the understanding of where psychiatry has been traditionally and where medicine in general is going from a functional standpoint, traditional psychiatry really utilizes diagnostic manuals that we refer to as the DSM. And these manuals allow us to interview a client, gather information, document symptoms that, according to the manual, will either allow us diagnostic clarity. I'll put it that way. So if you can imagine a person coming to you and saying, oh, well, I feel sad, I'm not sleeping too good, and sometimes I just lie in my room in the dark, right? That's their chief complaint, and they want you, the doctor, to assess them and give them a treatment plan. The assessment process with traditional psychiatry oftentimes does not include any imaging, any blood work, and it also doesn't include something that I believe should be standard of care, which is pharmacogenetic testing. So to simplify it, psychiatrists are the only doctors, the only specialty that does not routinely look at the organ that they treat. That's traditional psychiatry. We listen to what you say, we ask you some clarifying questions based on a symptom checklist, then make a diagnosis, oftentimes without ever looking at your brain, never looking at your genetics, or not even doing a physical exam or looking at your blood work. So that's a problem, and it is a very antiquated way of practicing that I've seen cause a lot of harm, yet we take an oath to do no harm. So I am very much so an advocate for the functional approach, and that starts with not only a thorough history in assessing symptoms, but gathering additional data, which usually includes functional imaging of the brain, pharmacogenetic testing, which allows me to understand how your body as an individual may respond to medication, supplements, and also looking at lab work, whether it be blood chemistry or some of the more specialized functional tests that I also do to look at hormone levels, to look at inflammatory markers. That would be the kind of nuts and bolts of the difference between what we've been doing and what we're hoping to make normalized as standard psychiatric practice.
What you described, as far as what you are hoping to make normalized psychiatric practice, made me feel like I was going to see my primary care physician, who was
Yeah.
looking into everything that is going on in my body to see how it's going to relate or impact other areas, right? So it really, what you're saying that you do, what you do in your practice, it offers for me a safer feeling when I'm dealing with mental health, because so
Mm-hmm.
many of our clients that come to us that may be considering going and being evaluated by a psychiatrist there's always that fear of,
Of
listen,
what?
I don't want anybody messing with my brain, my
Okay,
chemicals
that's
in my
one for
brain.
sure. Mm-hmm.
What about the side effects of these medications? What is it going to
Mm-hmm.
cause me to do? Hey, I don't want to become an addict. I don't want to be
Mm-hmm.
addicted to this thing. Am I going to have to be on this thing for the rest of my life to live?
Mm-hmm.
And so there's a lot of hesitation with dealing with brain health and knowing more about it, because I think a lot of times we don't recognize as a community that emotion and thought are connected to an organ, and that
Correct.
organ has to be dealt with, right? It has to be
Mm-hmm. It's
looked
the
at.
hardware. That's the
Exactly.
software. So if your
And it,
hardware is not working right, the software not going to be working right either. Yes.
so when,
So, but we acknowledge that. I think when we
mhm,
spoke before, I gave the comparison when you're talking about, well, let me just take a step back. So, to your point, what I described is a doctor meeting with you and evaluating all of the systems that can impact your brain. Usually, you're right. That is what's done when we see a doctor that specializes in family medicine or
mhm,
internal medicine. And the way that our medical system is structured in this country, there's a lot of disjointed functioning because we're so specialized. So you don't see it. If you got a kidney problem, you see a nephrologist, lung problem, pulmonary, cardiology, urology. And the next thing you know, you got 8 doctors and none of them are talking to each other. So what is that doing? So the understanding that all of the systems work together. I'm not saying we don't need specialized care. We need people that are only studying that part of the body because they're going to really, really know it. But at the same time, we don't want to neglect to look at other systems that could be causing someone to show up and tell me that they're sad, they don't want to go outside, and they're sitting in the room in the dark. But what my checklist in the manual would probably lead me to diagnosing them with is depression. And if a person comes to me and they, I'm nervous, I'm worried, okay, check a couple more boxes and you might have generalized anxiety disorder. So you mentioned the fear of the antidote, like the medications. Am I going to be addicted? Will you ever take me off? I'm gonna start before that. Did you even diagnose me properly? Because before we even start talking about medication, do we did we really come to the right conclusion as to what needs to be treated, how, and why? So that all starts with a real thorough workup, which again in our medical system, because it's in a capitalist model, time is money. So I'm sure everybody on this call has had that 15-minute appointment with their doctor. Like, wait a minute, I have more questions. Something else I wanted to, okay, make an appointment. See you next month, right? Because there's so many people on the schedule in this model that we don't have the time allotted that will allow us to do a full history. So I'm just going to say to your end, even doctors specializing in internal medicine, family medicine, are rushed in the evaluation of all your systems. And what I want everybody to remember, if you don't remember anything else I say, is we all have the same 10 major biological systems, and they don't work independently. We're multi-systemic beings, and these systems are intertwined by design. So the system that I spend a lot of times focused on is the central nervous system. That's the brain, the spinal cord, all your nerves, the electrical system. It does lots of things. Next, pulmonary. That's the lungs and your airway. Number one nutrient, oxygen. If you go without it, you'll know, because things look real different after about 5 to 7 minutes, okay? Next system, cardiology. Cardiovascular, that's your heart and your blood vessels. Your blood's job is to take that oxygen to every part of the body. So those are the highways going all throughout your body to get that oxygen dropped off. The next system is your GI system, gastrointestinal. It's one tube. Some people call it the septic tank. One tube from the mouth to the rectum. You also have to include the liver that's on the outside and the pancreas. They're secreting digestive juices so that you can digest your food, right? The fifth system is your immune system. I like to call it the army. It's the military, right? And we've got cells in our immune system that are in different branches of the army, right? They're stationed in different areas of the body to protect you from pathogens, bugs like viruses, fungi, bacteria, the things that want to take us out. Okay, so you need your army. It's very important. And when it's not functioning right, you can have a lot of problems. Well, the bulk of our cells, the immune system, a huge part of it is in the gut. Okay, because this is a real easy portal for bugs and all the things to get in. So I need my frontline defense right there in my gut, which is also known as the second brain. So those are your first five: central nervous system, pulmonary system, cardiovascular system, gastrointestinal system, and immune system. If a person is presenting with mood changes, energy levels are off, I'm depressed, I'm anxious, I'm suicidal, if I am not evaluating all of those systems, I've done you a huge disservice, because my immune system can make my brain present with those same symptoms. Wow. My gut can make my brain present with those same symptoms. And even your lungs can make your brain present with systems that would otherwise be diagnosed as, let's say, in some cases, panic disorder. I'll have a client come to me, I don't know, my heart's been racing, I've been feeling anxious. I told my doctor, they thought maybe I needed to come talk to you. I started asking questions. Do you wake up out of your sleep with your heart racing or feeling panic? You having panic attacks at night? Boo, that's sleep apnea, okay? So just, if you go down each system, MD for me stands for medical detective. I'm gonna find it, okay? So if I can't tell you how many people I've diagnosed with sleep apnea because they presented with fatigue, high anxiety, wow, falling asleep during the day, no motivation, because you're not getting any oxygen. Period. You're suffocating yourself. So that's the first five. Let's go to the second five. Your urinary system, your kidneys, your bladder, your urethra. The kidneys filter the blood. They take all the dirt and garbage out of your blood. Then they make urine. That's the trash. And then we urinate. That system is hugely important for detoxing our bodies, getting the toxins out. If your kidneys don't work, which is an epidemic in our community and a story for another day, because we got a lot of people whose kidneys are being killed by high levels of sugar. And now you got to go to DaVita dialysis 3 days a week. They rolling out the red carpet. I personally will pass on that. I'm going to encourage everybody, take care of your kidneys. But if your kidneys aren't working and you can't get toxins out of your blood, do you think that could possibly affect your brain? Okay. Next system, the skin. The skin is the integumentary system, the largest organ. A lot of people don't even know what it does, besides it's there to put lotion on. But no, believe me, it does way more, okay? It's protecting us from outside, for number one, but it's also a major detox. You need to sweat. I've met a lot of people who haven't sweat in years, okay? Sweating allows you to release toxins. Let's go to the next system, reproductive system. Most people know that system. It's our genitals. For a woman, uterus, ovaries. For a man, penis, testes. Next, we've got our endocrine system. I'm going to pause here for a second. This system is poorly understood by most, and it has so many effects on our brain health, our emotional well-being, that it's just a shame that we don't understand how the endocrine system works and how it affects the brain. Your endocrine system makes all the chemicals in your body that we call hormones. And those chemicals are coming from these glands that are strategically placed throughout your body. 3 of them are in your brain. So literally, your hormone system and your brain system are inseparable. Now, when you go to see a psychiatrist where you're getting a traditional workup, if they're good and, thorough, they will check usually a thyroid. The thyroid is one of those glands that makes hormones, but that is not the only part of your endocrine system that can impact your mood and brain health, but it's one that can impact it so strongly. It's one we usually routinely screen for and will address if a person is depressed and we found out your depression is because you aren't making enough thyroid hormone. So the last system, I call this system standing on business, okay? Because guess what? All those systems can't move around without structure and motion. So that's your musculoskeletal system. So the musculoskeletal system is your skeleton and all the muscles that allow your skeleton to move around and all these systems to move around. I'll say this about the skeletal system. Your blood is made in your bones. Okay? You ever cracked open a piece of chicken? I know I have. Boop, like that. What's inside? Bone marrow. That's your blood cells, red and white. Okay? And if you take all those systems into consideration, and I don't care what the presenting issue is, if you thoroughly work that up, you find real answers about what's causing symptoms. We make real diagnoses. If I don't look at your brain, how do I know you didn't fall down the stairs at 5 and have a concussion and you don't remember and nobody in your family told you, but now you're telling me your mood is switching back and forth and I'm going to diagnose you with bipolar? Well, actually you have a brain injury. And people who have brain injuries can present very similarly to somebody who we would otherwise say is bipolar. So it is a huge disservice to anyone entrusting a psychiatrist to evaluate them if they're unable to get access to a picture of your brain, some routine labs to look at some of those systems that I just mentioned, and give you the time that you need to explain your symptoms, your history, and all of that. So it is not a traditional approach for multiple reasons, one of which is just the coverage for time, imaging, blood work. Usually people do not have insurance that covers that type of a thorough workup. So how are they going to get it?
That's first of all, I want to say thank you for educating us on the systems and explaining to us how it all connects and how it all can impact our mental health, our brain health.
Mm-hmm.
And you bringing up the point about affordability to be able to
Yes.
get the thorough care that so many of us need. And even pointing out the fact that there are certain things that we won't know is impacting us, like, for example, a brain injury, head trauma that we experienced that we have no recollection of or no one told us of. So you talked about looking at the brain. What does that look
Mm-hmm.
like? If someone comes to you and you tell them, okay, I've got to look at images of your brain, what is that experience like? How do you even know what, when you're seeing pictures, like, how do you even know that something's going on with our brain? What are those things that identify that for you as a doctor?
So there are different types of images of the brain, and they're just different types of images in the medical field that we use to assess what's going on inside your body. Obviously, your brain is inside of a thick skull. You can't see it without taking a picture. So there are different types of images that we use, imaging modalities that we use to assess the heart, the lungs. So most people are aware of some types of imaging modalities. For instance, most people have heard of a chest x-ray. Okay, if I'm feeling short of breath, they're going to give me an x-ray. They're going to say, oh, look, I see some fluid in your lungs there. Do they know my diagnosis from that? No, but it's more information. Now they may ask different questions. What if I do a chest x-ray and your lung tissue looks very weak and your lungs look like they can't hold on to oxygen, and I see signs of what looks like on imaging that you may be a smoker? Okay, now I may think you're short of breath because you have COPD. So the image in any specialty is a tool to help you find the problem and the solution. So let's go past x-rays. Most people have heard of CT scans. CT scans give a more detailed image. We need a better picture, okay? Miss Johnson comes into the ER. She's short of breath. We got this chest x-ray over here. Her lungs are just cloudy. I don't know what's going on in there. I'm going to order a chest CT, okay? So now I get to see a more refined image. If I really want to get fancy, I may order a CT scan with contrast, because the contrasting agent really makes the image come alive. I can see more detail and hopefully more adequately diagnose this person who wants my help. Beyond a CT scan, most people have heard of ultrasound, right? Ultrasound is another type of imaging modality commonly used in obstetrics and gynecology and other areas of medicine. And lastly, most people have heard of an MRI. MRI uses magnetism, it's magnetic resonance imaging. If you have hardware in your body, we can't use that because once the magnet is on, fly off the table and stick to the side of the machine. So you have to consider each imaging modality and what the technology is of that, right? So MRIs are using magnetism, right? So if you consider that as just kind of your baseline, when it comes to the brain, we can use MRI, we can use CT. Go a little further. There are different types of CTs. There are different types of MRIs. A CT that most people are familiar with of the brain looks at structure. Okay, Mr. Smith just had a car accident. He came in, he's bleeding from the forehead. He said he got a massive headache and his blood pressure is dropping over here. What do I think he has? Probably an internal bleed. So I need to get a head CT stat so that I can see what's going on inside. Did he crack his skull? Did he pop a blood vessel? What do we need to do? Because if he's bleeding inside, I need to call the neurosurgeon. Somebody needs to get him to the OR, okay? That type of a CT looks at structure. The other type of CT that we have, which is called SPECT, which is the type of CT that I use, looks at activity and blood flow of all the major brain systems. So It allows me to look at your frontal lobe, behind the forehead, parietal lobes, temporal lobes, behind the temple, occipital lobe in the back, and the cerebellum. It allows me to see what areas are getting the most blood flow. Does anything look inflamed in here? Are you getting good blood flow? Does your brain look sleepy? It gives me an image that's giving me activity, not structure. Okay? So when the activity is healthy, every part of that brain lights up. It looks beautiful. If I have a client who's coming in because they are starting to get lost and not remember things, and I think maybe they have dementia, if I do a SPECT scan, I'll see that the activity in their memory centers and their areas that are responsible for direction sense, the parietals, they'll have low activity. I can see the dementia in real time. If I gave them a regular head CT, I'm not gonna see nothing because there's no broke bone, nothing's bleeding. So it's really, you might see with an MRI what we call neurodegeneration, like the volume, because it's structural, of the brain will look smaller, but it's not giving me that detailed depiction of where the activity is highest or lowest. When you also consider evaluating an organ that is as complex as the brain, you also want to consider evaluating the electrical activity. So for that, we use an EEG, an electroencephalogram. Most people have heard of that as it pertains to people who have epilepsy. If a person is seizing, me putting them in the scanner, it's not going to give me the information that I need. I need the electrical activity. So that's a different modality. So what I use are all of them, okay? But I use what's appropriate for the clinical situation. Here's where we have a problem, though. When it comes, again, to affordability and access, the rules have been written for us as to who needs what. Okay, so if you come in to the ER and you have a splitting headache and you're, light sensitivity and all these things, and I give you a structural head CT, they're going to bill your insurance. If you had it when you came in, you gave them the card, they're going to send that bill to your insurance. Your insurance will pay for that because according to a medical workup, standard medical workup for splitting headache and light sensitivity, they approve you to look at that person's brain structure. They don't approve for me to look at their brain activity. Okay? And I didn't make the rules, so that would be a whole nother story for another day as to why, we have access to certain modalities based on what someone has decided is necessary versus not. Okay, I call them the insurance gods because no matter what I think, they are the judge and the jury. Okay, so that said, that is a huge limitation. If I have someone that comes to me and they're hearing voices, I'm hearing voices. Okay, I cannot bill their insurance for a functional brain scan, but that's what I need. I need to see, number one, is there any evidence of head injuries? Going back to that again, because our brain is very fragile. And I don't care how careful you've been your whole life. You have hit your head once or twice. Some of us more than others, some of us harder than others. And usually if you go to an ER and I fell down the stairs. Whew, they say, well, everything looks good. You probably got a concussion. Take it easy. I mean, basically, that's what we're telling you because we're looking at the structure. If you didn't break a bone and you don't have a bleed, there's really nothing else for us to tell you. We're not doing anything else. But can I tell y'all that a person who's had a concussion, a functional brain scan tells a whole nother story. So we need advocacy for approval for certain imaging modalities that should be part of a medical workup. you all can decide why it wouldn't be. Because I know some of what I'm saying sounds like, well, that's common sense. Well, I have my own theories as to why certain things aren't paid for, but the bottom line is, in order for me to order a functional brain scan and for it to be paid for, you usually have to have a history of some type of brain bleed, because they see that test as you're evaluating blood flow. Most of the people I see, that's not what they're coming to see me for, right? And so the game changer for me with functional psychiatry was starting to see people's brains that I know would have otherwise been misdiagnosed and been forever given a medication that would suppress their symptoms. We're literally treating certain people with antidepressants and anti-anxiety meds who are walking around with a whole brain infection. And nobody looked, but their symptoms are better. So what are we doing? Like, so you have a person medicated, but they still have Lyme disease? Like, no. Or you have people who have had brain injuries. We're not telling them, let's get your omega-3 fatty acids in there. Let's do all the things that we know heal this hardware. We're treating symptoms. Oh, you got a headache? Oh, okay, no problem. Here's your headache medicine. The point is, that's a broken system. So
Yes.
I've had to make some tough choices just because I really am passionate about helping the underserved. I come from very humble beginnings. I have seen the health disparities, but unfortunately, in broken systems, you're forced to work within the confines of these rules. So in private practice, I don't have those rules if I don't bill insurance. I try to offer access to imaging as at an affordable rate as I can as a partner with Amen Clinics. And I've been able to help a lot of people gain access, but not nearly as many that need it.
Thank you for what you do. Thank you for your passion in making sure that people are being rightfully diagnosed so that they're getting the accurate help that they need. I think about in my own case where my eldest was diagnosed with ADHD, and just all the different side effects that he experienced on different medications. Or I think about, clients that may have eating disorders and, how the brain impacts the eating disorder, or things like, what the side effects of the wrong medication that they've been given. Maybe they're dealing with effects of that long term, being on long-term medication. And when marrying the Bible with psychology for us at House of Protection, it is a big area that we're breaking into when you're dealing with the church, because so often a lot of mental health issues have been put in kind of like a only spiritual box, because there's just a lack of understanding on the science of the brain, right? In the church, not in the medical
Can we
field.
please? Because
Yes.
that's major, huge.
Go
Do
ahead.
you see any other medical conditions that have that same approach of a spiritual explanation?
No.
Like we all know in the church, if you're depressed, it could be, girl, don't let that devil steal your joy.
Right.
Okay, that's the response. But do we say that if I have chest pain?
No.
Do we say that if I broke my toe? Right.
Absolutely.
So you can break your brain. So the assigning of the moral, spiritual piece, and I'm very much so a believer in God and a Christian. And what I know and I take is, the Bible says my people perish for lack of knowledge. And that's what I see every day. People don't know how their body works. They don't have a clue as to how to take care of it. So anybody can tell them and sell them anything, and they will. Okay. And then on the flip side, if you get your help from your spiritual source,
Mm-hmm.
They too are going to have explanations for you as to why you're feeling that way. And I'm sorry, but in both spaces, that is neglectful. I have seen a lot of, this is one that I've recently seen, and I'm
Yeah.
working it through and trusting God to help me understand what's the best way to approach that. But when you have faith that you've been healed, okay, it's that goes over a lot more easily when you can't see it,
Right.
right? Like it's not tangible. But what I try to tell people, have faith for
Yeah.
sure that you will be healed. But that doesn't mean you don't utilize the tools that God has given us to make that healing happen. Having
Yeah.
faith that you can be healed is not the same as saying, I'm good because God says so. That is not the same thing.
Yeah.
So that's something that I see, and it breaks my heart when I see it with parents who fail to disclose things that they know about the health of their children, especially as it pertains to neurodevelopment. I agree. I'm not a fan of the labels and all of that,
Mm-hmm.
and they can be very damaging. But you still have to have some level of transparency and willingness to have the conversation, even if stigma is in the room and we're afraid of what that leads to. So I'm just glad that you
Yeah.
brought that piece up because I see it in a lot of different communities and for a lot of different reasons. The psychological functioning of our brain gets that a ton. Now, the
Yes.
other functions of our brain, do you think in 2025, if you had a member of your church who had seizures,
Right.
would we say that ain't nothing but the demons that possess your spirit?
Right. No.
But we used to. We
Exactly.
used to. There was a
Mm-hmm.
time when we used to say that is demonic possession. Okay.
Yes.
But now we don't. Okay. But
Right.
we have to get there with the other things as well because your brain does so much. If I'm paralyzed, well, that's my motor part of my brain. Do you say I'm possessed with a demon then too?
Right. And you know what's interesting is when somebody is testifying of God healing them, if I've been healed from cancer, I've got medical proof that I've been healed
Mm-hmm.
from cancer, right? If
Mm.
something was broken, I have medical proof that it is now fixed.
Healed.
By doing
Mm-hmm.
brain scans, right? By getting that SPECT imaging done, somebody who
Yep.
comes to you with a broken brain,
Mm-hmm.
in whatever capacity, can always get that scan again, can't they? And would it
100%. We call it
the
the first
difference?
one is a SPECT, the
Mhm.
second is a respect.
Okay.
Okay. Put some respect on the treatment plan that worked. Yes. And I can give you one example that I saw that really blew my mind was a woman who she had battled alcoholism for decades. The alcohol kills the activity in our cerebellum. The cerebellum is in the back of our brain underneath that occipital lobe. It's the part of your brain that if you're drinking and driving and a cop says, okay, you're not drunk, prove it. Walk that straight line right there. They already know you can't do it because the cerebellum is taken out by the tequila. So this woman on her first SPECT scan, her cerebellum activity was non-existent. There was none in the building. I got to do her respect. It lit up like a Christmas tree, like just after 2 years
That's
of
amazing.
abstinence. And so it also is a motivator because, people respond to different types of, methods of motivation.
Yeah.
Some people just seeing is believing, like, I can't tell you how many young adults, especially since we're in the age of, cannabis fixes everything and cannabis is not a drug. Like there's levels to this and know what you're talking about before you say that because just like medicine is not the same in everyone, neither is cannabis.
Mm.
Okay. So I am not in any shape, form, or fashion anti-cannabis being used in the medical space. It actually used to be in the pharmacopoeia of medicine before the Prohibition Act. So it has its benefits for sure, but it also has many different chemicals in that plant. THC is it's on an island by itself. That chemical is not the same as some of the other chemicals that we may use for pain control or anxiety from the cannabis plant family. So I'm just going to say I have to spend a lot of time educating young
Educate.
adults who see this as an innocuous substance and then they're inhaling it. Well, when you rob the brain of oxygen, those are some of the worst scans that we see. And so when I have an individual that's minimizing the potential negative effects, I go right back to the systems. Well, okay, you say it makes you feel relaxed and you like it, but you're smoking it. Let me show you what not letting oxygen into the bloodstream does to brain activity, right? And so that too, just the picture is worth 1,000 words. I can say less when I can just pull up a picture of your brain. You're not arguing with me, argue with your brain. I mean,
Yes.
come on, you know? So
Yes.
it's so many benefits to getting the clarity, like you said, getting the proof of healing, because who told you you're healed?
Right. Exactly. The voice that you were hearing before.
God.
Right.
No
And,
shade, but like that's some people, that's
right.
their proof. And
That's the proof.
you didn't invite me to the meeting. Can I come to the next meeting when God announced your healing? I mean, I'm just saying. So it's
Right.
just my personal relationship with the Lord, and the God has told
There's
me
no
that I'm healed.
accountability.
Okay,
There is no anything else except for you said, God said. So
correct.
I have one more question for you. And then if you don't mind, I'd like to open it for two questions.
Okay, no problem.
Because I know the time is far spent and you all do not miss next month with Dr. Gettings. And for those of you that are on here and you're listening and you're like, you know what? I may need to make an appointment with her. Please make sure you let me know. I will get you all of her contact information. But I do want to ask this. How do I know if I need a brain scan? Because I have told my entire household when I have the money, every single one of us are lining up and getting our brain scanned. So how do we know it's something we need? When should we really go and like look into something?
Well, I think just like we screen other areas of our body, even if there's nothing wrong, the brain should be included in that list. We go get pap smears when there may be nothing wrong, but just in case, we're checking to make sure there's no change in our cervix and no HPV. We get colonoscopies just in case we might have a colon cancer. So I believe that there doesn't have to be anything wrong for you to see what your brain is doing in terms of health, right? You go get a checkup, don't you? So check your brain. There's nothing wrong. You don't have to be having seizures or hearing voices or have dementia to see if your brain is working well. So I'll just say anybody could
Mhm.
benefit from that. I have clients that come to me that see their brain because they just want optimization. I want to be the
Mm.
best that I can be. I want my frontal lobe firing on all 10 cylinders.
Oh wow.
So it what I think, going back to affordability, because health care is not a right, is a privilege in this country,
Hmm.
there are lots of people with coins and resources that, can I keep it 100 with y'all?
Please go
Like,
ahead.
this is just on their schedule annually.
Wow.
Like, this is just what I do,
It's a
right?
part of
I
their
get HBOT and I get anti-aging infusions and I, all the things.
wow.
This is your maintenance plan, okay? So, but for us, for people who don't have those resources, we're begging just to get it and there is something wrong and they still saying no. So to me, that's neglectful. And I will say that to anybody, unapologetically. There are lots of things systemically done in Western medicine that end up being neglectful. Whether it is, truly intentional, if you will, but there's so many rules, regulations about what you can access. A lot of times people aren't accessing enough. When I was in med school and we would do rounds, I was on my internal medicine rotation. I started to, I mean, I'm what, in my 20s? everybody who was on the med floor was like 65, 66, 66-year-old presents with abdominal pain. We did a CT scan. You got stage 4 colon cancer. Dang. Okay, 63-year-old woman came in. I'm like, the 60s, that's the decade where everything catch up with you, okay? So I asked my attending, I said, why are we not just scanning? I said, I just need a body scan next to my bed. I need to check, okay? Because I don't want to be the person that had to wait for symptoms to show up for me to then get a workup. Where we are right now, the only thing that we really screen, when you consider screening, colon cancer, cervical cancer, prostate cancer, breast cancer. It's a whole lot more cancers, y'all. And it's a whole lot more conditions where if you had an image, my attending said, well, a lot of times we haven't proven that more routine screening leads to better outcomes. They'll also argue that if you screen more, you're exposing yourself to the radiation that may come from some of these imaging modalities. Okay. I'm still not convinced. Okay. So for me, I say evaluate yourself as often as you possibly can with what you have. Mm-hmm. Everything doesn't have to be an image. One of the things that I use, and I'm going to send to you so we can send to everyone who's listening, is the brain health assessment tool. Okay. It helps you to evaluate each one of your major brain systems based on symptoms that come from those areas without necessarily seeing the picture. So if I am working with someone and they can't get a scan, I at least have a reliable tool where I'm able to, again, I'm doing a systems approach, not a symptoms approach. I'm looking at the major brain systems, not taking those symptoms and putting in a cluster and diagnosing you with your symptom. Okay, because that's basically all that happens now. You depressed, you got major depression. Anxious, you got generalized anxiety. Okay, so if you consider that, I just think that working with what you have is key. And if you have the knowledge, you can still work towards that being your course of action. But you got to first know that that's the approach that you need. What really, really gets me is people have drank the Kool-Aid. When I say people, I mean, I can have this conversation with some people and they looking at me like, my gut got something to do with my brain. Okay. Like if you start talking to people about, well, you know, person comes in, you're depressed. I'm looking at them. I'm doing my physical exam. I get to nutrition. Well, what are you eating? Well, I don't eat bad, but I don't really think that has anything to do with what I got going on. Okay. Well, let's see, you know, like, so we have drank the Kool-Aid of the brain is over here on an island and has nothing to do with what you consume, has nothing to do with any other systems. I mean, that is absurd to even think that. So, but we've been convinced of it successfully in a lot of ways.
Thank you for taking the sugar out of the Kool-Aid for us.
Yes, throw the whole Kool-Aid bottle away, okay?
Yes, ma'am.
I'm out here saving people from Alzheimer's. They say Alzheimer's has now been dubbed diabetes type 3, okay? Yeah. So
and the imaging, so I just want to be clear. The brain scan, the SPECT imaging that you do can detect Alzheimer's as early as like if somebody's in their 20s, right?
Correct.
It's coming?
Yes, for sure. And here's another one for you. So a lot of people been diagnosed with dementia, and that's not what they have. Imagine being 70, 75, whatever, and you're having these symptoms of memory loss and everything that looks like that, but you actually have a toxin exposure that you weren't aware of. Mercury is a toxin, okay? Go back to people who have silver fillings in their mouth. I'll wait.
All of
Mercury is in there, and that's a neurotoxin. And it may not make you sick right away, but over time, you know, some of the signs that mercury is, those fumes are in there: hearing loss, ear ringing, dizziness, because it can really easily access some of our cranial nerves. They're right there. You know something else that causes dementia? Poor dental hygiene. People who don't get their teeth clean. Bacteria, gingivitis. Your brain is your mouth's next door neighbor. They
Wow.
talking. Okay?
Wow.
So consider all those things, and wouldn't you, I'm not saying that that's, the bulk of the time, but get the right diagnosis, use the modalities to get the information and know that that's what you have. So yeah, it's
Thank you.
beyond needed. Yeah.
Thank you. And before
Thank
I
you.
have Dr. Paulette ask her question, I just want to acknowledge Precious Sargent. She's in here with us.
Hey, Precious, that's my girl. That's
So
my girl.
Precious
Thank
is a
you,
good
Precious.
friend of mine. We attend the same church together, Bread of Life Community Church, and she is the one that connected me with Dr. Gettings, and I am so grateful. So I want to publicly tell you, thank you, Precious, for this gift. Thank you so much.
I still remember the first time I met Precious, February of 2022. She had just come into the Hollywood clinic. I believe it was
Mhm.
2022, not 2023. And she had just came in, and then she had to cover for a week, fresh out the gate. I mean, Precious was rocking. Okay, so Precious has always been a joy to work with, and I love that she made the connection. So thank you so much, Precious.
Thank you, Precious. All right. Dr. Paulette, please take yourself off mute and you can ask your question.
Okay, thank you, Suzanne, and thank you so very much, Dr. Gettings. I really appreciate what you said because it's the same thing that I've been trying to talk to my clients about. Because when they come in and say, I feel I'm no longer have um, interest in anything that I do and things like that. The first thing that I say to them, when was the last time you saw your PCP to see what your blood work is like and things like that? But also, one of the things that just the other day, we had a client that came in and said that she was diagnosed with bipolar. But she also said that she has been trying to control her situation at home by not sleeping and just eat and just drinking coffee.
Mm.
Yes, and they still diagnose her with bipolar. So I'm
Mm-hmm.
thinking if you're not sleeping, you're going to be tired, you're going to be depressed, sad, and you're drinking coffee, you're going to get anxious. A lot
And
of
lack
coffee.
of sleep causes
Yeah,
mania,
yes. So,
right? Mm-hmm. And
so,
psychosis.
and so the thing is, I was saying to the therapist that was working with her, probably she needs to talk more about talk to the doctor more about what is going on with her instead of just diagnose her with bipolar. But I really, really enjoy what you have said, and
Thank you.
I really want to do a brain scan for
Yes.
myself because
Yes.
one of the things that I did, I've been having a lot of brain scan because I had a stroke.
Okay.
No one did mostly the not the blood flow or the
Mm-hmm.
activity. I think they did just the structure
And
because
the
I can
probably a angio, like looking at your arteries, like a CT angio. Mm-hmm.
no, they didn't
No.
do that. They
Okay.
haven't done that. So
Okay.
but they looked at the structure, so I was able to see where the stroke took place.
Was okay.
Yeah, but they just said they didn't say anything else, and I think
Okay.
it's more because of the insurance, because one of the doctors was saying she wanted to do this but she do something else, but she wasn't sure if my insurance could cover it.
Did anybody tell you how to heal brain cells post a stroke?
No,
I didn't think
no,
so.
no. So
Mm-hmm.
I probably need to talk to you.
Mm-hmm. Let's do it.
Yeah,
Yes.
and so I
I have
really
several clients that I'm working with now that had
mm,
strokes post COVID.
mm-hmm,
Some even after vaccination, not necessarily confirming that there's correlation, but just kind of giving you a backdrop post-COVID. And SPECT is a really good tool for you to see if the neurons are healing or not. The number one tool for healing brain tissue that has lost oxygen, which is what a stroke is, is oxygen. Okay, so watch this. Do you think your insurance pays for you to get oxygen as treatment for your stroke?
No.
Mm.
Yeah, I don't think so, because for
No, they
me
don't.
to get, so I really appreciate what you're saying, because that's what I want to employ
Address.
or want to tell address with my clients every time that I see them. And I do believe that this brain health assessment tool will be something good for all the clients, even if they don't have the scan. That's something that we can definitely
and it's
do.
free.
And Suzanne, please get it, so we can address
and let me tell you this.
to find
let
out.
me tell you one other thing. It's great that you're encouraging your clients to see their doctors. However, a lot of times they're going to come back and say, my doctor said I'm fine, because you can only get access to what that doctor knows to do to work something up. And we've been trained based on a model to check this for that, check that for that. And also the labs that we use, the labs that Western medicine doctors use, oftentimes are limited in their ability to identify blood chemistry abnormalities that are not consistent with a major level of disease. What I'm trying to say is their labs are more calibrated for when you sick, okay? I don't want to just see that it's out of range because I waited too long. Like, can I get a functional lab that may give me numbers that are not, diseased as yet, but still not the healthiest as they should be? So sometimes people go to the doctor, like I went to my doctor, she checked my thyroid, she checked, I'm fine. So you got to get specific, like, well, what did they check? What lab did they run, and where did you go to? Right.
Speaking of labs, Dr. Gettings, there was something that you said at the beginning, that you suggest people getting a pharmacogenetic testing. Am I saying it correctly?
Yes.
And that has to do with medications, right? To see how the body.
So the insurance companies recently started covering pharmacogenetic testing. If you have Medicaid or Medicare, it's actually free, but it's been around for a long time. So there was a lot of lobbying and advocacy for coverage, and now you have it. Pharmacogenetic testing looks at two things. It looks at how fast or slow your liver metabolizes medications. Why do we care about that, Dr. Gettings? Well, because if I take 500 milligrams of Tylenol and my liver is not your liver, and you take 500 milligrams of Tylenol, we may have different levels of that Tylenol in our system, and yours may leave your system faster than mine, right? So that's called pharmacokinetics. So you get to see, am I fast? Am I slow? The next key piece of information is the pharmacodynamic portion of the test. We look at genes that you actually carry that dictate if you'll even respond to a medication. Do you know how many people are out here taking meds that are never going to work for them, period? And if you just did this test before you gave them the trial, you would know that you were probably wasting your time. And psych meds don't work like a pain reliever. You got to take this for weeks sometimes for it to even be effective. So you mean I took this all this time for what? So pharmacogenetic testing should be standard of care in my opinion, and it doesn't just, it's not just useful for psychiatric, it's useful for all. I used to work on the south side of Chicago at a hospital where a lot of my patients had sickle cell, and they're coming in because of a pain crisis. And there used to be this term that we would use if a person was there longer. Excuse me, let me correct myself. A term I would hear if a person was there longer than what a doctor thought they should be, they immediately start to think they're drug seeking. They're drug seeking because sickle cell pain crises are so painful. You're usually going to start some type of opiate, a strong opiate to get them comfortable. But by day 3, you should be better. Well, they're not doing any pharmacogenetic testing. So there are some people who don't even respond to morphine. There are also people who metabolize it really fast. So even though you thought you gave them enough to last 4 hours, it actually only lasted 1 hour with their liver. So instead, we call them drugs again. Like, can we just see if there's a chance that their genetics is playing into the fact that this medicine isn't controlling their pain when you think it should be? So I am so glad that, you know, we at least have crossed that finish line. But
Yeah.
I used to be the secretary on the Illinois Psychiatric Society board, which is the Illinois branch of the American Psychiatric Association. And I spent a lot of time in Springfield. As you all can see, I could talk loud, going to different people's offices, like, we need this paid for. And I found out that in politics, a lot of it is this: how much money do you have for lobbying and getting bills passed? It's very disheartening a lot of times to see just how unethical certain systems are. And we really need a lot more things approved in order to be well. So
Yeah, and you know what, doctors get in. I have been where, for me, I noticed that when I'm taking medication, it doesn't affect, like the side effects is not like right away. Like they normally say, oh, if you you should be able to see the side effects right away or in a day. It doesn't happen to me. It takes some time. And so when I go
And
back
then
to
they
my
look at you like,
doctor,
what?
yeah, when I
What do
go
they
back to
say?
my doctor, they're saying, "Oh, you should have seen the side effects before." So probably it's not the medication. And I'm like, that's the only thing that I've changed. That's the only thing that
Doctors aren't even being
and
trained to do pharmacogenetic testing, just so you all know. Like,
yeah,
that's not even standard right now in terms of training.
right.
So that's another piece to your point. Well, I can tell you a smart answer that I would say if a doctor said that to me, like, well, but my genes might make it different, right? Okay, but what I'm saying is some doctors, when you take pharmacogenetic testing to them, or here's a big one, so many people after they've had their brain scan, they'll go take it back to their local psychiatrist, and they haven't looked at any imaging since residency. And we also weren't trained to apply that imaging to psychiatric diagnoses. So they will typically not really know how to incorporate that. So the main, and this is no shade to Western trained doctors, because I am one, but functional medicine is where we're headed. Western medicine, as it is a very much symptom-driven Band-Aid on a bullet wound, as I call it. Put a calm down the symptoms, versus a functional approach where I'm actually looking at how all of your systems are working, diagnosing you properly, and trying to minimize your exposure to any harmful pharmaceuticals, doing integration with supplements, minerals, all those things, and using medicine, of course, when it's needed, but it definitely shouldn't be the only thing, and it shouldn't be what you reach for when you don't even have all the information. So, yeah.
That's good. That's Angela, did you have a quick
Precious put
question?
in the chat the companies that we commonly use for pharmacogenetic testing, Genomind, GeneSight, and Tempus. And GeneSight's been around a long time, but thankfully you all have access to that. And again, Medicare, Medicaid is free.
Thank you so much. Angela, did you have a question? We're going to end with Angela's question. Those of you that may have questions, please go ahead and email me at wecare@houseofprotection.org, and we'll do our best in next month's session with Dr. Gettings to see if we could get a couple of those answered, okay? So, Angela, what's your question?
Real quick, two questions. One is everything reversible in the brain? Can with the right nutrition, the right supplements, can there be a reversal? Let's say for damage done by strokes or a stroke, or
Okay.
yeah.
Great question. So is everything reversible in the brain in terms of dis-ease? No. Okay. However, your brain does want to heal itself. It's wired to do that. The term we use with there is kind of like neuroplasticity. So you can post a stroke, promote new blood vessel growth. That's angiogenesis. You can promote new neuron connections, but you have to have the ingredients for it. The number one ingredient is hyperbaric oxygen. And I can send you all information about that. We offer, Precious can tell you, at Amen Clinics, they have a hyperbaric chamber. There are lots of places that offer hyperbarics for stroke, for survivors of stroke. You also have to consider, where was the stroke? How old is the stroke? And was it a hemorrhagic stroke, meaning a pipe burst and you bled on your brain? Or was it a ischemic stroke, meaning you lost blood flow? So there was no bleed, but you have a clogged artery. That too can impact healing, because if I have an ischemic stroke and it's caused because the carotid artery in my neck is the only pathway from your heart to your head. So if it gets blocked with plaque or something like that, people start to have strokes, but the plaque is still there sometimes, right? So I'm trying to heal the wound, but I'm still being wounded. So what do we do now, right? So it really depends on what the disease is we're talking about and a lot of other factors. But for sure, there are a lot of things that when it comes to brain disease that are reversible and curable, okay, but not all. So it really varies.
Okay. My second question is, you hear all these commercials about a depression medication for your depression medication, like and
What in the insanity is that? Okay.
yeah,
Yes.
it's like crazy.
Please take the wheel, Jesus.
Yeah,
Ooh,
it's like crazy.
well, it's not crazy. It's capitalism is what it is, okay? But in your face. And don't forget the nice lady running through the lilies while they run down all the different side effects. May cause death, sudden dying, and yeah, all that. They hope you didn't pay attention to that because you was distracted by the lady running through the field. But here's the
suicide. You're taking something for depression.
right. They just skip over that. Come on. And for kids have a higher risk of suicide as a potential outcome from taking antidepressants, to the point that there's a black box warning on it for adolescents. So if you give an adolescent an FDA approved antidepressant like Prozac or Lexapro or Zoloft, it's going to say on your packaging, black box warning, may cause suicidal thinking, blah, blah, blah. You've seen it. So pause for the cause. Have you ever asked yourself why someone is marketing drugs to you? Have you ever asked yourself why that's legal? Have you ever asked yourself, where is it legal? Because it ain't legal in many places, but it's legal where you are. So ask yourself, why would that be banned in a lot of places? Why do a lot of countries not allow pharmaceutical companies direct consumer marketing, right? Number one, it's unsafe. And a lot of times what it leads to is a patient coming to you like, I know exactly what I need. I need that new Abilify Matena. And you don't know nothing about pharmacology, okay? But you heard it on a commercial and it sounded good and you want to look like that lady in the field of the flowers. So no, just no to all of it. You know why it seems crazy? Because anything that's nonsensical, that's how it's going to look, right? So there's a lot of manipulation behind marketing pharmaceuticals directly to a consumer. It does increase sales. It does increase people seeking medications and blindly trusting them in a lot of cases. So that is definitely a talk for another month, but that was a great question.
Thank you so much for clearing this up on nutrition, because I'm 67. The stories I've heard of my mother's grandmothers, great-grandmothers, who were sharing volume, who were throwing themselves out a window, during menopause because
you know that whole nervous breakdown. Gotta love that decade, don't you? Yes. I'm going to share one more thing. I know I have to wrap and we all got to go. I did a podcast just last week. It's called Did God Make Me Crazy? And the topic was to educate the audience about how hormones, going back to that endocrine system, affect women in different stages of our lives: premenstrual, pregnancy, and also peri and postmenopause. So there were questions given to me that I answered, but made it a handout just for future reference since it was such good content. So I'll share that with you all because I'm glad you brought that up too, about the menopause and brain health. So many women back then, she had a nervous breakdown. You're right. Her nervous system sure did break down because it was losing estrogen. Okay. So understanding that can help save marriages. Dr. Amos says all the time, menopause will cause some divorces. It will. I'm just putting that out there. Okay. Those hormonal changes are not for the weak, not the woman sometimes, and not the people that she lives with either. So that said, if you educate, okay, males, right? Most people know hormones affect the woman's brain because most people, if you say, what is PMS? Oh, that's when a woman is having her period and she's kind of moody. Okay. But what about what her mood does in menopause? I would argue it could be a whole lot worse and a whole lot more at stake. So that said, we need a lot more support around women in that chapter of life and their spouses so that they're not just labeling them, stigmatizing, or any of those things, judging, shaming. You cannot control the aging process. You can mitigate symptoms. You can make sure you know what to put in the body to minimize the effects of these changes, but they're going to happen with or without your consent. So I'm going to send that so you all have that too. I think it's real good info.
Thank you so much, Dr. Gettings. And I will send everyone a link as well from the Psychology Today website, right? Is that the one?
Yeah, and YouTube. I put a lot of information on YouTube on my channel. Is Dr. Gettings, just DrGettings. I started it for health literacy. I make videos to educate people the same way we just did today because knowledge is power. And that's where it starts. My website is drgettings.com. It is currently being revamped. So there are no direct links to me there. But if you have questions, if you want to pursue a consultation, yes, please share with them the link that I gave you from Psychology Today. That gets you directly to me through email or phone.
Awesome. So thank you again, Dr. Gettings, for sowing your time into the families of House of Protection. We do not take this lightly. Thank you for educating us, equipping us to become better at taking care of our total body and how that impacts our mental health. And we look forward to a partnership with you. And we look forward to next month. For those of you that will hear this later, that may be a donor, a partner of House of Protection, we do want to be able to provide Dr. Getting services to our families, that we would be able to at least cover half of the cost for them. And so we're going to be working on that on the back end. But if this is something that you're passionate about, helping people get a proper diagnosis, to get a proper treatment plan, and helping them to just really get the healing that they need, I invite you to reach out to me and let me know that you specifically want to partner with us in this area. So thank you. Thank you, everyone, for taking the time to be with us today. It was wonderful having each of you. And I pray all of you have a wonderful day. And I pray that God just continue to be your peace and your sound mind. God bless you, everyone. Bye-bye.